Good evening mga ka-3PM, narito po kaming muli. Ako po si Peter Serrano para sa Ano Pilipinas, Attitude Pa? An original program brought to you by 3PM, Luzon, Visayas, Mindanao, Pilipinas muna. A very, very happy New Year po sa inyong lahat. Nandito na po ang 2022 na hindi ko nakita ang pagpapalit ng taon because with the year coming in, nagkaroon tayo ng napakalaking surge na nangyari sa ating pandemic battle na tumataas na naman today. It was said by our guest when he came in to greet us earlier na we have 33,000 today cases, active cases. Active cases yan po lang yung reported. Hindi pa po kasama dyan yung mga hindi reported. Like I myself I was positive. Ang onset po dumating sa akin last December 31. And up to now, I'm on isolation. I'm on my 10th day. And they say dapat fully vaccinated like myself. Sabi ng DOH, 10 days lang daw ang isolation. And there are so many things that we need to understand about Omicron. We have read so many things about it. Napakabilis niyang makahawa. But they say kahit mabilis siya makahawa, mild naman, mas mild ang kanyang mga symptoms. Unlike Delta and the first Covid-19 that came to us last 2020. And to help us with our discussion today on nasa na ba tayo? Kinalalagyan ng buong mundo, hindi lang ng Pilipinas, sa hinaharap nating pandemic na dumating sa atin last 2020 and we're on 2022. Pangalawang taon na po, pushing on our second year. Nasaan na ba tayo? And to help us with our discussion, he's a former UP Executive Vice President and Task Force for COVID-19 Advisor. Please welcome on 3PM, Dr. Ted Herbosa.
Hi, good evening, Peter. Happy New Year. At sorry to hear na may mga events na nangyayari at napakataas ng cases. Let me correct you, it's not 33,000 active, that's 33,000 new cases.
New cases.
Yan yung mga bagong kaso na na-diagnose sa mga laboratory. And as you know,
today,
yan yung mga lumabas pa lang na PCR positive, okay. PCR test. And we know very well, during this pandemic, ang dami nag-antigen test. At pag nag-positive sila sa antigen, nag-isolate na lang sila. So, mas mataas like pa dyan yung 2 hours. Like you, if you did antigen, mas mataas pa dyan sa 33 ang totoong number ng may mga COVID. And we know it's an Omicron outbreak kasi nga ang Genome Center last week sabi 60% ng samples nila Omicron na eh. So baka ngayon 80% na. So at saka yung characteristic talaga ang bilis, ang bilis ng pagtaas. 5 days ago
Sobrang
it was only
bilis.
10,000. Yes, it was only 10,000 new cases January 5. Pag tiningnan mo ngayon January 10, triple na, 33,000. Can you imagine that? In 5 days nag-triple yung numbers natin.
Doc, syempre, itong Omicron, may isang taong sinisisi, ano? Ito yung sinatawag natin na si poblacion girl na nag-skip ng kanyang quarantine, went to a party, and that's when it all began, as they say. Doc, is this an accurate finding that she actually she spread the Omicron around?
Well, let me just explain what the people in epidemiology are saying. Mukhang the Omicron had slowly entered us as OFW started to come back as early as November. Kasi remember, November 26 ito na-identify.
Yes.
So even before November 26, kung may Omicron at nakauwi, baka nakapagpasok na rin yan. And then it slowly started. Now, poblacion girl became a sensation because to me, it showed how infectious this particular variant is. One person skipped quarantine, went to a dinner party, infected 10 people. They went to a bar, infected the owner of the bar, the mga bartender, etc. So you can see what one person did, and she was asymptomatic. Kasi hindi naman siya magpa-party.
Yeah.
And she was asymptomatic, and she was super spreading it. So, ang reproductive number ng Omicron is about 5. Diba? 2 yung sa previous, yung mga deltas. This is 5. So, one person can infect 5. But a super spreader like poblacion girl infected easily 15. And of the 15, nag-infect na rin yon sa kanya-kanyang mga bahay. Kasi inuwi nila yun. Diba?
Yes.
So, plus may secondary level contacts pa silang na-spread out. So that's why importante talaga maintindihan ng mga nanonood sa atin why if you travel from abroad, especially from an Omicron country like the United States of America, na million a day sila sa America.
Millions, yeah.
1 million a day new cases. Ha? So if you come from the US, talagang quarantine ka muna to protect the Philippines. Kita mo naman, mag-i-spread ka lang. Now, the second part of your question, is she the cause? I don't think so. I think Omicron will really invade the Philippines. Sinabi naman ng health officials natin yan. It's not a matter of time, but it's a matter of when. And it came sooner than we all expected. I was expecting middle of January. Wala pang middle of January, nag-33,000 cases a day na tayo. So nakatalagang pinag-party lang tayo, tapos wala na naman. Pandemic pa rin.
Pinatapos lang yung ating pinakamahalagang season, which is the Christmas season. And now, we're back to parang as before.
Yes.
Kasi, Doc,
well,
yung
tama ka rin, tama yan. We're back as
kasi,
before.
Doc, yung scare, di ba, Doc? The scare is like how it was when the pandemic began.
Yeah, that's correct. And not only that, it's infecting so fast, no? Although it's not killing as fast. So tama naman yung sinasabi ng mga ibang tao. It's not as deadly as Delta, but it still kills. Ha? May mga namatay. Kahapon, 16 deaths kami sa PGH, COVID-19. So nakakapatay din siya. Ha? Now, what's important is, of the 33,000 new cases na ni-report today, 97% is mild or asymptomatic. So, maganda yon. Hindi ko sinasabing maganda may 33,000 tayo. Sinasabi ko, maganda na yung 33,000, 97% nila ay ano tawag dito? Mild asymptomatic. So let's say ang usual estimates naming doctors mga 10% ng mga yan na magkaka-COVID ay mangangailangan ma-ospital. They will need to go to ER kasi may hirapan na sila huminga, it's really bad, or they had other illnesses, they get worse. So 10%. Do you know how much 10% of 33,000 is? 3,000.
Yeah, that's 3,300.
3,700 or 3,300. Yesterday, the day before, was 28,000. So the day before, would have been about 2,800 na nangangailangan din ng ospital. Plus, you add the 3,300. That's already 5,000 looking for. Saan kami
Yes.
kukuha ng tama niyan? I think the public should understand talaga na we should break transmission. Talagang pag nagkaroon ka ng symptoms kahit mild, stay home na please mga nakikinig dito sa video blogs na to. If you feel
Yeah.
symptoms or if you were exposed, sore throat, headache, di ba? Masakit lang ang katawan, and you're self-isolate na tayo, mag-teleconsultation tayo, ang daming available teleconsultation, some are free because it's from government.
Yes.
Sa PH, may telegabay kami, nasa Facebook siya, magme-messenger ka lang with a doctor. Or there are numbers you can call from the DOH hospital. Meron ding private hospital kung gusto mong private ang tataw. And then they will decide na kung kailangan mo mag-test, kung antigen test lang, or etc. So, and then mag-self-isolate tayo. We break the chain of transmission. Huwag ka na mag-public, huwag ka na mag-LRT, huwag ka na mag-Grab,
Yes.
huwag ka na mag-seat, di ba? Huwag ka na mag-elevator sa building kasi mga hawak, di ba? Di ba? Mga hawak na stay at home and then watch Netflix or something. Basta stay at home.
That's what I did, Doc. When I first felt that it was very ironic that day when it nag-onset sa akin. Because I have a friend here. Meron siya from the 15th floor, kasi nasa 20th po ako eh. On the 15th floor, she said on our group chat, kasi may magkakaibigan kami dito, may group chat kami, she said that she's positive. So I have medicines, I have linhua, so I gave it all to her. I gave it all to her. So I went down.
Generous.
I went down, tapos I put it in a plastic bag. I just sinabit ko lang doon sa pintuan niya. Yeah. Tapos on that day, because December 31 po yun, Doc eh. So I was making macaroni salad. That's going to be my contribution for our get-together after ng 12 o'clock. I was already feeling bad until I think that was already 4 p.m. when I was making the salad. So, and then I said, I don't think I can make it. When I felt, Doc, na medyo bumagsak yung pakiramdam ko, I already knew na meron na ako. And then, I isolated myself already. In fact, nakakatawa, Doc, kasi may kasabay ako sa elevator. I said, uy, bakit wala ka alcohol? Mag-sprayan kita, ha? In-sprayan ko siyang ganon. Tapos, kasi I'm very careful inside elevators, Doc, eh, when I brought the medicine to my neighbor. So ngayon, when I've already felt that I am getting the virus, Doc, what I did was, I asked medicine from my neighbor. So my other neighbor gave me linhua. Because I gave out everything that I have to my other neighbor. Buti lang the people here are very neighborly, my friends here. So he gave me the linhua and I began taking it. I started boosting on vitamin B complex, D3, and vitamin C.
Correct.
Which I always have with me. Yeah, so I boosted on the vitamin C. I never ran out of fruits, so I eat fruits. Ganun po yung ginawa ko. And then on January 2, my brother sent me an antigen kit. January 2 pala, sorry, January 2 on a Sunday, I lost my sense of taste and smell.
Yun na. Oo.
Yun na. That's confirmed. Tapos January 3, I did my antigen test, of course, positive. Doc. So up to now, I'm in isolation and I'm standing this. Even
what day of isolation ka na? Pang ilang araw?
10th day. 10th day po today.
Well, my advice is if you're fully vaccinated and you're on your 10th day, kailangan you had 3 days na asymptomatic ka. Wala ka nang nararamdaman for the past 3 days. And you're good to be released by a medical. Well, if you're going back to work, a doctor can write you a medical certificate. But if you're still having symptoms, dagdag ka pa ng days. You must have the 3.
Actually, Doc, I'm extending 5 more days of isolation.
Nararamdaman ka pa. Oo. That's good.
Wala naman po na ako nararamdaman, Doc. In fact, I did a stretching kanina and a bit of calisthenics just to test if I will cough up or kung hihingalin ako. I did not.
Good. Oo. So, actually, if you wala ka ng temperature, wala ka ng sore throat, you have no symptoms, I think pwede na mag-risk. But you're right. Extending it to 14 days might be a good idea.
Yes, I'm extending it to 14 days.
Your thinking should be the way our people should think. I don't understand why you come from another country, it's an Omicron, and you will go out kasi nga, the quarantine is not for you, is not against you. It's to protect the other Filipinos by
Precisely.
intermingling with them. Nung unang panahon nga, kino-collect sila sa island, di ba? Sa New York, merong Ellis Island. Sa San Francisco, pagdating ng ship, dun kayo, 14 days, kaya quarantos. In Latin, it's 40 days, 40. So, bubonic plague, cholera, talagang iaano ka muna doon. Si Rizal na quarantine yata yan sa San Francisco Kaya galit siya sa Amerika.
So yun nga, Doc, the responsibility you have to give out to other people, because the virus is a deadly virus no matter what we say about Omicron being mild symptoms so vaccinated. Doc, kung hindi vaccinated, how will Omicron affect you?
Well, majority of those that are in hospital are unvaccinated. So they reviewed 2021, 85% ng mga na-hospital were unvaccinated. And in the ICU, 95% were. So the promise of the vaccine is that it will not prevent you from getting the illness, but it will make the illness very mild, just like what you have. You're vaccinated, right? So the other thing I'd like to say, we vaccinate because we also want to protect our family members, our colleagues in the office. It is also an act of love na nagpabakuna ako para hindi ako makahawa. And that's true. Like if you know, the IATF may ruling na restrict the movement of the unvaccinated. At syempre, inaaway tayo ng mga human rights groups na bakit daw ganun. In fact, tama yon. Ako, to me, ayaw mo magpabakuna, I'm sorry, di ba? You are an agent of transmission. So you are a threat to public health. So I should limit your movement kasi mahihirapan ang health system natin pag marami kang hinawa. The viral load of a person who is unvaccinated is going to be higher than a person who is vaccinated. Kasi may antibodies ka na . So pag napasukan yung virus, your antibodies, which was made by the vaccine, will now start fighting the virus. So hindi sila makadami kaagad. That's why the illness is also milder. Kasi hindi makaproduce yung virus sa katawan mo. Whereas a person who's unvaccinated, that's an alien substance. Wala silang antibodies panlaban. So it will overwhelm their body. So magkakasakit talaga sila. And then they start to develop symptoms. Antibodies lang after the natural infection. So very important.
If they surpass it.
If they surpass it, that's the danger. Kasi nga, sabi nila, Omicron is like a vaccine daw. Pero ako, nobody recommends that. No doctor in his right mind will recommend na magpa-Omicron ka na lang, parang binakunahan ka rin. Because it's like a risk. Para kang nag-Russian roulette nun. Hindi mo alam kung may bala yung pinutok mo o hindi. So, don't know if kayo yung mamamatay. So it's better to just get the vaccine. So sa mga nakikinig, kung hindi pa kayo nababaccinate, magpa-vaccinate na kayo. Kung wala pa kayong booster, magpa-booster na kayo. Ang booster is already good 3 months after the second dose. So kung kayo ay nabakunahan ng October 10 or earlier, pwede na kayong pumunta sa vaccination center. Just bring your vaccination card and we will give you a booster dose. We have plenty of vaccines now. That's the difference between last time we were fighting Delta. When we were fighting Delta, patak-patak lang yung dumadating na bakuna. Last December, we received about 64 million doses of vaccines.
Wow!
We have mga 90 million. Yung mga in-order natin, tsaka yung mga dinonate sa atin, nagdatingan lahat ng month of December. The month of December, we had more vaccines that came than the first 9 months before na patak-patak lang, 1 million, 500,000. So, umating lahat yung mga in-order natin at binigyan pa tayo ng mga donation ng friendly countries. Kaya umabot ang stockpile natin to about 90 million. May 90 million tayong stockpile. Yun. So, very important.
Ako po na nagkaroon na nag-positive ako, vaccinated ako. I was scheduled actually dapat tomorrow for my booster. Kailan po ako ulit pwede magpa-booster? After my 14th day, which is on the 14th. January 14, yung 14th day.
2 more weeks after you recover. Kasi your immune system, Peter, is still mahina yung immune system mo kasi lumaban siya dyan sa infection mo. So parang weak pa siya. You need to have a convalescence or mag-recover ka back to normal about 2 weeks ang estimate. So if you get the infection, wait 2 weeks and then you get the booster. Para parang nag-exercise ka, pahinga muna, rest, and then recover. After the recovery, i-push na naman yung immune system mo to build more antibodies. But actually, this is your booster dose. You got infected, diba? You had 2 doses.
Okay.
You are fully vaccinated. Then you got an infection. You got natural immunity now against Omicron. So technically, that's even better than getting the regular booster kasi hindi pa naman figured in yung Omicron doon. Kung Omicron meron ka ng antibodies against Omicron. Actually, mas maganda immunity mo. Pero bakit ka namin gusto magka-booster? Because nagwe-wane pa rin yung antibodies. Even if you got these antibodies for Omicron, after 3 to 6 months, bumababa siya. Kaya binabaccinate ulit. Yan ang reason. That's why I'd still recommend that you get your booster. Pero sabihin mo na dun sa nag-schedule sa inyo na you tested positive and you will wait 2 weeks and schedule you.
So 2 weeks. Ladies and gentlemen, you have to remember that. Pag nagkaroon kayo ng infection, isolate yourself for 2 weeks, get better in 2 weeks, then count another 2 weeks for the booster.
After gumaling ka, the convalescent period. So you want your immune system to recover muna para pag hindi ka ng booster, magpo-produce na naman siya ng antibodies. Yun, parang pag nag-exercise ka, di ba? Ganong dagdag ka lang ng dagdag ng weights para lumaki yung muscle mo. Ganon.
Yes, Doc. Doc, ako po kasi, hindi ako nag-antibiotic because I'm very, very scared with antibiotics. I don't really medicate myself, and whenever I feel something, I don't drink medicines. I just rely on my vitamins, especially on my vitamin C. So what I did po is, I did my natural, nagle-lemon shots ako every morning, nagsasalabat ako, yung totoong luya yung ginagamit ko.
Yung lemon shot, okay lang. Tequila.
Wala po. Lemon lang talaga.
Lemon lang. Lemon lang. Walang tequila.
Wala po. So I have a full shot glass of lemon. I take that every morning. And then because I believe in natural medicine, so pardon me, Doc. So I do my garlic. I pound my garlic and I just take it with honey. And then that's my morning routine for my medicine, which I do naman, Doc, even if I'm not sick. Tapos at night, I drink the really pure ginger sa labat. Tapos I boost my vitamins and I took my linwa every night. Kasi wala naman po akong severe cough. So I just take my linwa every night, 3 capsules before I go to bed. So that's practically what I have been doing, Doc, for the past 2 weeks to medicate myself. Doc, tama po ba yung mga ginawa ko?
Okay. Let me explain, Everything you did, honey, lemon, garlic, linwa, these are things that are even older than Western medicine. They're even older than paracetamol. This has been used by Ayurvedic doctors even before for symptoms like trangkaso and flu. So these are age-old traditional alternative healthcare. And Western medicine has no say kasi kung thousands of years nang ginagamit yan, they do work. Garlic has been studied. It does have some anti-inflammatory capabilities. Vitamin C from lemon, of course, you need the vitamin C for the immune response or immune booster. So if your body's fighting a virus, talagang tama, you get garlic and then honey, of course, is it relieves the symptoms of the sore throat and the inflammation in your kasi upper respiratory tract infection, so the honey actually helps. And then of course yung mga tablets na ininom mo. Linwa is also for what we call internal heat, sabi ng ating mga Chinese doctors. It's for internal heat. When you're having fever and your body feels hot, linwa relieves you. And I'm sure pag iniinom mo, pinagpapawisan ka, yung nagko-cool off yung body mo. That's how
Hindi nga po, Doc, I'm just taking it because I don't have the cough, I don't have the lagnat after the second day. So I'm just taking it for prevention to cough at night.
No, but actually, you have to ask a Chinese doctor kasi when I ask Chinese doctors, paano magamitin yung linhwak yan? Yan ang explanation nila. They have 2 types of fever. yung meron silang hot and internal and external, yung yin yang nila. And they use that they hindi not for all cases. So ako, ang advice ko sa nakikinig, huwag kayo mag-self-medicate ng linhwa. You should ask a experienced herbal doctor. Kasi ako hindi ako experienced dyan, so I cannot give advice. Pero ang maganda sa sinabi mo, hindi ka nag-antibiotic. Why?
Hindi po.
Antibiotics are for bacteria. An antibiotic is given if you have a bacterial infection. If you have a viral infection like itong coronavirus, the antibiotic doesn't work. You know what the antibiotic will do? It will strengthen, it will boost the ferocity of the bacteria in your body. So baka lalo magkaroon ka ng resistance. So baka magkaroon ka pa ng super infection after your immune system is down. So it's bad practice to take antibiotics for a viral illness. Now, why do doctors start to prescribe antibiotics? We prescribe the antibiotics if your course no longer follow the course of the viral infection. So hindi ka nagre-recover, may ubot, lagnat ka pa rin, lampas 7 days na. Then we start to prescribe antibiotics. That's why today we now require you cannot buy antibiotics in the butika anymore.
Yeah, without prescription.
You have to get a doctor's prescription. Kasi nga, we are fighting antimicrobial resistance. We are trying to lessen the abuse of antibiotics. Kasi lahat ng tao, Doc, may may lagnat pa, reseta naman ng antibiotics. Sabi ko, tatanungin ko, ilang araw ka na ba may lagnat? Wala, 2 araw pa lang, gusto na nila kaagad mag-antibiotic. Kasi, nung nagpatingin sila before, binigyan sila ng antibiotic na doktor. Hindi naiintindihan na binigyan sila ng antibiotic ng doktor kasi siguro hindi na sila gumagaling kaya nagpunta sila sa doktor. So the doctor diagnosed you have a bacterial super infection. So it's called a secondary bacterial infection. When your immune system is down, a second infection can come in. And that's why you don't get a booster when you just had your COVID-19 kasi baka makasama yun kasi mahina na yung immune system mo. Immune compromised. So other bugs can infect you. So kailangan mag-ingat rin. You still need to be careful after a bout of COVID-19 kasi nga you are prone to get bacterial infection. So huwag ka rin masyadong magpunta sa matataong lugar muna. Make sure you need to go out.
Actually, Doc, hindi talaga ako palalabas. When the pandemics came in, hindi talaga ako palalabas. Tapos when I go out, the going out is necessary. Hindi po ako lumalabas just to, party and everything. I go on my meetings and we make sure that the meeting is open air and stuff like that. So I was very careful. But this onset of the bacteria, which I came from, I don't know where it came from. Doc, gaano po dapat nating bantayan? Kasi hindi po natin, sabi nga po ng kaibigan ko, ang hirap ng kalaban kasi hindi natin nakikita. Paano po ang pagbabantay na dapat namin gawin upang hindi kapitan, hindi magkaroon ng virus or para makaiwas pa? Of course, the mask is there, the washing, the alcohol is there. Pero ako, yun po ginagawa ko I still caught it. Is there any other way to prevent
there are other things that will help our immune system become strong. So number 1, having adequate hours of sleep. Yung mga nagpupuyat yan, humihina immune system yan. Pag tinamaan yan, mas masama. Yung mga medyo walang exercise, obese, sila pag tinamaan yan, medyo mas grabe sila when we see them in the hospital. So, very important, yung mga lasenggo, yung umiinom, sabi ko, tequila. So, if you're always drunk, they're also prone, their immune system is down. Kasi, pag lagi kang bagsak, di ba, from drinking nightly, your immune system. Kaya nga, di ba, the doctors prescribe you antibiotic and tell you not to drink. It's really to help the immune system. So, ganun din to. If you're always out drinking, your immune system gets, di ba, hindi ka makakain, may hangover ka, di ba, parang your immune system is fighting a problem. So very important to keep our immune system healthy, to keep our body healthy. So eat right, eat on time, eat plenty of fruits and vegetables. Why am I recommending fruits and vegetables? Because the fruits and vegetables has the micronutrients. Kasi yung mga rice, bread, then of course they have the carbohydrates, yung mga meat, merong protein yan. Pero the micronutrients are in the fruits and the vegetables. The more colorful the fruit, the more colorful the vegetable, the more micronutrients there are. The micronutrients are what we need for the immune system to function. Yung mga zinc, iron, etc. Those are found in the vegetables. So it's really good to eat. The more colorful your plate is in terms of salad and fruits, the healthier yan. Kasi nga, marami kang makukuhang micronutrients. And the micronutrients are the vitamins, the trace elements like zinc, iron, etc. Yan yung mga nakukuha dyan.
Doc, nasalagay po natin, of course, today, 33,000, katahapon, 2,800, at tunataya na bago matapos ang taon, aabutin tayo ng 40,000 per day na bilang. Doc, ito bang nangyayari na surge na ito? Kasi po may naglabas ng findings from the University of Santo Tomas. Sinabi nila that ang Omicron daw, ganito talaga kabilis, pero this is the end, the beginning of the end of the pandemic. Is that accurate, Doc? The finding that Father Nicanor Austriaco, who's a molecular biologist from UST, he came up with this study, and he said that if we can show it, Lilibeth, so Doc can see what he actually said. Sinabi niya na it is the beginning of the end ang Omicron. Yan, Omicron, the beginning of the end of the pandemic, but public has to remain careful, of course, that's what he said. And then he came up with with the finding na ito nga daw, as you said, siya yung doktor na nagsabi na mas maganda na magkaroon ka ng Omicron is like, because as you said, Doc, para itong booster concerns whether COVID-19 vaccination. Doc, ano po ang masasabi niyo sa finding ni Father Austriaco about it?
Okay, there's some level of... Actually, let me explain that he retracted that statement and said that...
Oh, he did?
Oh, he did. In fact, you can look for it. Father Austriaco says that Omicron can kill. It is mild. It is milder, and then to use it. Kasi nung araw, naalala mo ganito. Let me explain how that concept comes out. Nung araw, nung bata kami, wala pang bakuna. Sorry baby boomer ako. So hindi ang bakuna kasi 60s lang eh. Late 60s lang ang vaccines eh. So nung bata kami, pagka nagkaroon ng tigdas o chickenpox yung mga pinsan ko, sinasabi ng nanay ko, punta ka doon, Ted. Punta ka, Teddy, doon sa pinsan mo, maglaro kayo. Para magkaroon na ako ng chickenpox at or measles, ko ano man yon, or mumps, para mahawa ka na, then you become immune. So that's what is meant by natural immunity. Pinaghahawa-hawa talaga yung mga bata nung araw. But that's a very risky thing to do. Kasi lahat ng bata nagre-recover. May batang mamamatay. Kasi magkaka-complication. So lalo na kung mahina ang immune system mo or malnourished ka or payat. Ay, nung bata ako, malnourished ako, payat ako. So today, when we recommend that na mag-Omicron ka na lang para kang binakunahan, hindi yan safe. Kasi no doctor today will tell their children or will tell their patients, ay, wag na natin bakunahan yan ng measles pag magpahawa na lang siya sa ibang bata. Because there is a safer alternative to doing it now, which is vaccines. The vaccines are safe and they're beneficial. So, I'd rather give you a weak illness. So, hindi ka lalagnatin, di ba? Medyo lagnatin ka a day after the vaccine. After that, wala na. I'd rather get that than risk my life with an Omicron illness na pwedeng mag-complicate ako. Baka magka-brain fog pa ako. Baka magkaroon pa ako ng long-term effects, myocarditis or something. So, hindi... For us doctors, remember, Father Austriaco is a priest and a molecular biologist. I think he's a good friend of mine. I think he's just being hopeful, you know, as a priest and as a preacher. They sell hope. That's their expertise. I cannot sell hope. I'm a man of medicine, and I will tell my patients what they have, di ba? Kahit magalit sa akin, may cancer ka eh. Kailangan natin. operahan ka. That's how we were trained. But of course, he's a priest. He's telling the people, huwag kayong mag-alala, there is hope. Mukhang the Omicron is weaker and it looks like the end of the pandemic. But we don't know
Mm.
that. That's the
We
problem.
don't know that.
We don't know that. And in fact, the scary part is we just saw another report of another variant in France, which is the IHU variant, the EHU
Yeah,
variant.
IHU.
You read it too. It's got 46
Yeah.
mutations compared to the 30 of remember, Delta had 10 mutations in the spike protein. Omicron has about 30. This one, IHU, has 46. So kakatakot din kasi baka hindi nga ito pa yung endgame. Baka si IHU endgame or baka meron pa. Or baka kagaya ng influenza hindi na mawawala, walang endgame. It becomes
Yeah.
endemic. It becomes endemic and seasonal, which is what is happened to the flu. Remember, the Spanish influenza killed millions,
Yes.
and on the third year, it killed more people than on the first year. So it got deadlier, technically. It does. And eventually, it just mutated, and siguro walang vaccine nun eh. There was no
Yes.
vaccine in 1918. So it just continued its natural course, killing millions of global citizens. But today, we still have the influenza. We have vaccines, but we get the vaccines every year. Kasi every year may mutation, may different serotype. So our vaccines is not a one-time vaccine for influenza. It's a yearly vaccine, di ba? To prevent us.
Yes.
It's seasonal. Kasi alam natin kung ano yung season na dadating. So we get the shot before the season, especially mga matatanda. So I think in some ways tama yung science na sinasabi niya, pero I cannot say parang I cannot predict the future. That's parang prophesying. Parang prophesying na endgame na mahirap masabi. I wish.
Yeah.
Like
I
all
wish.
of us. I wish he's true, but I'm a disaster guy. My field is disaster medicine. I always naman the opposite of him. If he's hopeful, ako yung guy na always ask, what if? What if this is not the last mutation? What if there is another re-emerging infection? What if there is a new one that replaces this? So the way my brain works is different from the way a priest thinks. So ganun din yun. Tapos remember, he works in a laboratory. I work in the hospital. I'm a clinician. So I see the patient. I see them having difficulty breathing. I see them, getting put on a tube and attached to a ventilator. And I see them dying. So we count them as they die. So very risky to give that message. That's why I think he retracted, because some of his doctors and all said, teka muna, baka mamali. If you hear what WHO and CDC is saying, do not underestimate Omicron. Remember? And I
That's what I said po, Doc, eh. When I read, because of course lahat tayo may family group chat, ano. It was my brother who sent it to our to the group chat. Of course, ang una reaction ko, sabi ko, sabihin niyo sa lahat ng tao sa opisina, magtabi-tabi na. Alam mo yung ganon? Kasi Doc, when you hear something like that, and it's coming from a reliable source, like Father Austriaco, you somehow think that it is okay na thankful pa pala tayo dapat na dumating ang Omicron. Not natatamaan ka ng Omicron, or dapat magka-Omicron na lahat ng tao, because he said it is a natural vaccine and it is an okay variant of the virus. So Doc, hearing what you are saying to us right now, so hindi at ni-retract na rin naman ni Father.
Yeah, Father's retraction saying that he wants to say that Omicron still kills. Even if it's a milder variant, it can still kill.
Yes.
Yung statement na niya. So hanapin mo yun. Actually, that's his latest book, which clarifies, kasi nagkaroon ng misconception. Many people will cling on to the hope. Pag sinabi mo sa kanila, doon sila magkikling eh. Pag sinabi kong, hindi naman siguro cancer yan. Pag sinabi ko yun sa pasyente, mag-hope siya. Or the patient will go to another doctor, pupunta sa second opinion. A doctor who will tell them na hindi yan cancer. Mali si Dr. Herbosa. Hindi yan cancer. Masyado siyang blunt. So ganun, no? It plays on the minds of people. So we call this in disaster medicine risk communication. Naalala mo yung incident sa Baguio? Yung merong meningococcemia?
Yes.
Oh, yeah, naalala mo. That was a season. That was a summer where everybody did not go to Baguio. They went to Bohol and Boracay. And Baguio suffered economically. When they went back and discovered what was the problem, unrelated deaths ng mga bata. Hindi pala meningococcemia. When WHO started studying the deaths, hindi sila meningococcemia. See what a rumor can do. What a false statement.
Okay.
What a half-truth can say. Baka meningococcemia. Boom, it blew like anything. And nobody went up to Baguio for that summer. But economically, maganda for Boracay, maganda for Bohol kasi tumaas yung tourism nila. Pero ang Baguio nag-suffer. So, we should be careful, no? Especially in times of pandemic like now. Risk communication is the number one thing we need to import. So, this messaging by the government na may a few lang na nagsasalita, di ba? You see people who are the spokesperson, Yusek Perhere, the spokesperson of the president, para clear yung messaging. Kasi mahirap malito. Ang problem natin is social media. Yan ang
problema.
Kasi
napakamaling usage na eh.
Naku, I get a lot of that from my mga nieces and nephews who send me all these things. I said, is this true, Tito Ted? Is this true? Tapos babasahin ko. It's not true. Don't share it. Don't even reshare this. Kasi the more sensational, the more willing you are to share. Like a rumor, di ba? Pag sinabi mo rumor, ni Marites mo, Mare, ano ba ang dyan, latest, di ba? Ikaw, you want to be the scoop person eh. Gusto mo ikaw yung nakascoop eh. Sabihin mo, in the hope na akala mo totoo yung sinasabi mo, tapos fake pala. And you don't know the damage you create. You spread fake news, you spread fear, you spread anxiety. So it's best to listen to the mga experts, best to listen to people who are, even experts like Father Ostrato, who is not an expert on risk communication, made a faux pas. It's a faux pas in terms
Kasi there was a video that he made. He was actually talking about it. And I listened to it. And I was really, nung narinig ko yun, sinabi ko, because I researched on him, sabi ko, he probably know what he's talking about because he's a molecular biologist. So, Doc, yan sinabi niyo, risk communication na yan, na nangyayari ngayon with the kind of situation that we are in right now. Who should we just listen to? Of course, I would listen to you, Doc, because you are an IATF consultant and you are, as you said...
There are many sources of truths and the key is to verify the facts. So expertise is not sold on us advisors. Hindi lang kami. There are many experts. Even Father Austriaco is an expert also in molecular biology. But you have to find out what the expertise is and what they're talking to. What I am peeved at is you have experts on mathematics and they're being asked about public health and epidemiology and they answer on national television. Teka muna, hindi mo na linya yan whether this vaccine or this is effective. Teka muna, I don't think you have the competence to answer that question. Just tell them, I'm just a mathematician. I have no expertise with that. You ask the doctors or the infectious disease or the epidemiologists that question. But they can model. I mean, we are all, healthcare today is parang team sport. It's like a team sport. You have mathematicians that can model. You have computer experts that can put all the data in AI and then do data analytics. They help us. But in the end, it's us doctors and clinicians who have the license to do and say what we have to say to a patient. Kasi kami ididemanda pag namatay sila eh. Hindi naman sila eh.
Yes.
Diba?
Yes.
Kami, pag sinabi ko, Omicron ka na lang, tapos namatay, dididemanda ako. Diba?
Yes.
And we've had cases here, like I know of a case in Cebu, celebrated, talagang dinimanda yung doktor tsaka yung private hospital. Kasi hindi siya naniniwala sa ginawa ng doktor. So there are risks to what you say and what you do. Words are very important. So very important how to frame it. I'm a disaster guy. I like to scare people. Kasi when you scare people, behavior changes. So,
yes.
If I tell you, Omicron, baliwala yan, mild yan, parang natural vaccine lang yan. That's not the message I want to give to the people. Kasi ilalabas na sila. Hindi na sila hindi nila alam. Yeah, it's mild. But look at the hospitals in New York. Look at the airlines in New York. In the US, huminto, walang flight, di ba? Kasi nagkakasakit lahat. So, it may not kill you, but it also causes a lot of inconveniences in society. Di ba?
Doc, with
Kalat-kalat.
how we are right now, sa dami ng cases natin, would you as a task force for COVID-19, would you still recommend a lockdown?
No. I think the lockdown era is over. The lockdown doesn't work. What the lockdown does is it just decreases mobility, but it makes there are unintended consequences because people
Mm.
lose jobs, walang daily wages, mas maraming nahihirapan, and the government ends up spending more. What we need is
Yeah.
what we are having now, which is what people, yan, and that's another rumor pala that spread. I saw a text like
Yeah.
that. Next week, magkakaroon na ng lockdown na ECQ, di ba? Sabi ko, hindi na totoo yan because we've moved to what is called the alert level system. So yung alert level system, parang typhoon signal yan. So,
Mm.
nilagay tayo ngayon from alert level 2, inakyat tayo to alert level 3. Ano nangyari? People knew what to do. I went out January 3, papunta akong PGH. Walang traffic, walang tao sa labas. Whereas nung December, di ba, grabe, alert level 2.
Yeah.
Talagang everybody was out, the children were out, the families were out. But
Yeah.
when the government declared alert level 2, aba, naintindihan ng taong bayan. They stayed at home. And then now there's a rumor na baka itaas sa alert level 4. Pwede rin yan. But you have to understand the alert level system is combined with what is called the localized lockdown approach. So that means
Mm.
ang lockdown mo are smaller units of society, smaller geographic areas. In fact, ang pinupush ko ngayon yung household lockdown. If you get an infection, like yesterday, 3 families tumawag sa akin. Lahat sila 2, 3, or 4 people already infected. Sabi ko, mag-household lockdown na kayo. Yung mga bata dyan, consider them infected na rin. And just keep everybody for, like what you're doing, quarantine the whole place. That's safer. You're in your comfortable space. You're in your home.
Yes.
You know, pwede kang tumawag sa mga order, dali na lang ang pagkain ng Grab, di ba?
Yeah.
Everything can be done easier than when I extract you, the head of the family, and put you in an isolation facility for so much anxiety, di ba? Hindi mo alam kung makakakain yung family mo. So, the government has put out this messaging na mag-home quarantine tayo. Home quarantine na talaga. Mag-antigen test tayo. Sabi nila yung antigen test hindi accurate. Pero at positivity rates of 46%, ay, magpa-positive yan kung positive. Like you, for example, you use the antigen.
Yeah. Positive ako sa antigen.
Oh, alam mo na, di ba? Actually,
even if I already knew that I have the virus, I still did the antigen. Nakakatawa nga, Doc, eh. Kasi when I did the antigen, malinaw na one line lang yung lumabas. So, ipinicturean ko na yan, sinend ko sa family group chat namin. Sabi ko, negative ako, ganyan. So, everybody was happy. And then when I looked again, appeared the second line, pero medyo malabo. So I took a picture of it again. Sabi ko, na-excite yata ako. What does this mean? And then my brother said, positive ka.
So, si doctor yung
even if, no, hindi naman po. But they've been doing antigen test po with themselves. Ngayon po,
the 2 lines will positive ka. Dapat yung...
Yeah. So ngayon po, yung dalawa kong pamangkin, PCR sila, they're both positive. Thank you, Lord, na vaccinated ang mga pamangkin ko. So they're having very mild symptoms. Except yung first day nung isa kong pamangkin, nagkaroon siya ng chill and body pains. But right now, she is doing okay. She just needs to complete the 2-week isolation, which is supposedly the practice.
That's interesting you mentioned that you have 2 pamangkin. Actually, my daughter is also positive. So she's a doctor. She was working in the hospital, pero vaccinated. So if you talk to any person now, any of your friends, everyone knows someone that has turned positive. So that's
true, Doc.
Omicron is, no? That's how you cannot meet a person na walang kamag-anak, kapatid, or whatever na nag-positive, na hindi nag-positive. Pamilya pa yung nai-infect. So, and it happened in when we were enjoying Christmas and New Year, tanggal tayo ng mask, nag-relax tayo, and it came back with a vengeance for us. So, parang ni-remind tayo ng virus, teka muna, nandito pa kami hindi pa kami nawawala. We haven't disappeared. I think the lowest we got was like 190 cases per day. Can you imagine 190 cases just before Christmas? And today, wala pang 1
We're
month
back
later,
to
33,000. So it is really a very
33,000.
vicious virus. It's really a very vicious virus. And it's infecting even fully vaccinated. Kaya nga nagbo-booster pa tayo.
Yes, yes.
So,
Doc,
so
with regards to antigen, right now, FDA said that the what you buy online or what you buy from somewhere that is not yet FDA approved, you may be risking your results. Is this an accurate finding of the DOH, Doc, na FDA? Nasasabihin nila that
yes,
these antigens are its accuracy is questionable because it hasn't been approved yet by FDA.
correct. So all you do is get an FDA approved. But even if you do get an FDA approved, what happens is not all antigen tests were created equal. So merong mas accurate, merong mas palpak. So like
Mhm.
anything, the quality of a car, may magandang high-end na kotse, merong low-end na kotse.
Yes.
So
Yes.
depending on the money you're willing to shell out. Number two,
Oh.
even if you say, let's say you do the high-end and you do a swab on yourself and nasaktan ka, hindi mo, pinull out mo na, nasaktan ka. You might not be
Mm.
doing the proper self-test. So remember, officially, the government hasn't approved home testing. Although nag-home testing na sa UK, sa US, and
Yeah.
it's being practiced by our Filipinos, but the government hasn't officially. The official recommendation is that a medical professional will do the antigen test. Di ba? You still have to go to a facility, a med tech will do it, or a doctor will do it, and then. But it's very simple, di ba? I
Yeah,
think.
very simple. But when I did it to myself, I have never been swabbed
Uh,
ever. So ako yung gumawa sa sarili ko because may indication naman doon, Doc, sa
hanggang saan?
swab
Oo.
ko hanggang
Oo.
saan. So I just do it. Dinahandahan ko talaga and did
Comfortable,
what
di ba?
was the instruction. Comfortable naman, Doc. And then I got the result. Shouldn't we recommend, Doc, ikaw, Doc, as an IATF consultant, would you recommend home antigen test?
I'm on that side. I'm on the side of approving home antigen test kit. Especially ako, I also didn't know how to do and I have antigen test kits as well. But when I only needed to do kasi I get PCR. I think I had about
Yeah.
60 PCR tests kasi every time we were on the airplane, we went to Malacanang. Talaga kailangan naka-PCR kami. So ang dami ko talagang tusok sa ilong and it's not very comfortable. So
Yeah.
I had to attend the wedding. The people who were getting married wanted us to have antigen test. So I did that. I find an antigen test kit. I was reading the instruction, parang ang complicated. Nag-YouTube na lang ako. I typed in the brand and the YouTube was simpler. The YouTube explanation
Yeah.
of how it's done and how to. So I wanted to do it right. Now the problem is you don't know if everyone will do it right. So that's the
Yes.
fall. That's the pitfall. Not everybody is as literate as you and me. Remember, our level of education is not the same. We have different levels of
Yes,
education.
yes.
So I think we have more people that probably cannot understand an English instruction or an English
Yes.
video. So mahirap mahirap mag-recommend kaagad na dadami false negative. The fear of administration is when you allow home testing, many will self-test. And if the timing is wrong, your timing is correct because antigen test must be done to a person who is symptomatic. Kailangan may symptoms ka na. Because if the viral load is low, yung na-expose ka kahapon, nag-positive, the following day, nag-self-test ka na, magne-negative yon. Ang tawag namin doon, false negative. Kasi hindi niya na-pick. So you have to wait a period of time and then you usually 5 days from exposure.
5 days, yeah.
5 days or with symptoms. Kung let's say 3 days pa lang nagka-symptoms ka na, pwede ka na mag-antigen test because when you have symptoms, mataas yung viral load. Mataas ang chance na ma-pick up ni antigen test yung positivity. So, yun yung difference, no? Yung PCR, kahit konti yan, madidetect yan. In fact, hindi ka nga PCR pag gumaling ka na kasi kahit yung mga dead virus, napipick up niya, nagpa-positive pa rin. We've had people who never turn negative 3 months, 6 months kasi nga may viral remnants pa sila. So, very important.
Pero yung pong kagaya ko na Alam ko po that in 2 weeks, which is on the 14th,
Okay ka
I
na?
will be negative. Okay na ako. Do you still recommend that I get my test?
No, no more. No more. It's
No
just
more. Because
your
that's what
symptom.
people are asking right now.
No,
If
you
they
don't need
are...
to. Well, unless your office or the place where you work wants a return to work, then you get a doctor certificate. That's why we recommend
Okay.
home care. Kasi sa home care,
Mm.
may doctor na nagbabantay sa'yo. Who'll also tell you,
Mhm.
get your temperature, show me the temperature, di ba? So pag
Mhm.
na-record mo talagang 3 days wala kang lagnat, I will give you issue you an electronic medical certificate. Pero may ibang
Okay.
doktor,
Okay.
ayaw mag-issue ng medical certificate pag online lang. Kasi
Uh-huh.
sinasabi nila, hindi namin na-examine physically yung patient. So I mean, I didn't
Uh-huh.
touch you and feel your skin na talagang wala kang lagnat.
But isn't that more dangerous, Doc? Kagaya nga nung question ng isang audience natin, si Lizelle. But isn't that more dangerous that you go to a
But
medical facility
face to
to
face,
get
oh.
yourself
Correct. That's
tested?
actually more dangerous. Kaya nga, ako, I'm criticizing the doctors who don't want to give a medical certificate online. Kasi nga, yung
Mhm.
baka ang takot nila, baka mapalabas nila false negative. Baka meron pang
Uh-huh.
remnants. Infectious pa siya. So yan yung mga nuances nitong situation natin ngayon. But of course, dumadami na ang possibility to do telemedicine. In fact, madami na talaga.
Oh. Doc, with regards naman, kasi usong-uso ngayon ang Airbnb. Usong-uso ngayon ang staycationers. I don't know why people go to a certain place to vacation, and it's just in Manila anyway. So anyway, siguro dahil dito po kasi sa condominium namin, may mga nagsa-staycation dito. Now, our
Ganda
fear
siguro yung
was...
condominium, no? Maganda siguro condominium yan.
May maganda
Bakit
naman po yung
staycation ka?
swimming pool area namin dito. So yun po yung isa sa mga hit dito. That's why the staycationers are swarming to this establishment. Now, Doc, ang medyo kinabahan kami, especially ako, nag-positive ako the administration said that vaccine cards are not required.
Huh?
Magsasign lang daw ng declaration sa baba, meaning sa lobby, and then it will be okay. Pwede na walang vaccine card.
Well, you know the administration's
Kasi po
policy.
sa IATF policy
Oh,
po, gusto ko po maintindihan dahil national po ang IATF policy, hindi po ba? Na
correct.
dapat
Oh.
sundin ang lahat. So
Yeah,
ano
we are
po
trying to
masasabi niyo
restrict.
tungkol dyan?
Well, it's not yet a policy. The city has to come out with an ordinance that unvaccinated cannot go out at alert level. And many cities, I think MMDA declared it. So sa Metro Manila, if you're in Metro Manila, they should abide. Your condominium should abide with the, and you have to check with the city kasi the city will have to come up with an ordinance, which is the basis showing the vaccine card. So they cannot enter the building without showing proof of vaccination. So ang recommendation ko dyan, kausapin mo yung homeowners association nyo or condominium corporation and to make sure that any Airbnb should actually have fully vaccinated. That lowers your risk. In fact, mas maganda nga, meron pang test. Either a
Yun nga
negative.
Sinabi
Kasi
naman nila, Doc, because one of my friends here emailed the administration. And the administration, Lilibet, can we show that email, please? Yung sagot no admin, so it will be more accurate. Ayan po, as of now, guests or visitors for staycation are not required to be vaccinated. Only the health and travel declaration form need to fill up by the guest. The guest and visitor are, if the guest and visitor are from overseas, they need to submit a COVID swab with negative results. Doon po ako na sa first paragraph, yung as of now, guests or visitors for staycation are not in capital letter pa nila lahat sinulat, Doc, required to be vaccinated. Isn't that
parang
alarming?
anti-vaxxer yung administration. No, actually,
Hindi ba, Doc?
I fill up all health declarations. I go to the airport to welcome vaccines. But the health declaration form that I fill up asks me. They ask me many things like whether I had symptoms and whether I was vaccinated. It's in the health declaration. I-declare
Mm.
mo pa kung anong date ako nag-vaccinate at kung meron akong first dose, third dose. Yun, nandoon siya sa health declaration. So kulang yung information niyan, no? My advice is I think you as homeowner should ask the administration to change that policy kasi you want to protect the residents kasi you're in a building. You can get
Yes.
affected in the elevator even if you don't meet each other. You must know the number of people who are positive in the building. Dapat
Mm.
naka-declare yan. Para people can be careful. So I think kulang 'yon, ano. Tapos yung mas worried ako dun sa foreigners that come in, mas
Yeah.
dapat they
Must have
should
a
present.
swab, negative result ng
Hindi
swab.
yun eh. Dapat ang
Kaya nga
result,
eh.
what they should ask for foreigners is a quarantine certificate kasi baka nag-travel yan. So if they come back and then rent an Airbnb, they must show the proof of quarantine which is issued by the BOQ. Yung nag-hotel quarantine ka. Kasi ano yan eh,
Aha.
when you travel, like let's say si poblacion ko, dapat nag-stay siya dun sa Berjaya Hotel ng 5 days kasi vaccinated siya.
Aha.
On the 5th day, isa-swab siya. By the 6th day, lalabas ang result. Yung negative result, hindi pa siya makakalabas noon. Ibibigay pa yon sa Bureau of Quarantine, which is an attached agency of the Department of Health. And the Bureau of Quarantine will issue a certificate of quarantine. And that's the only time you can go out. In fact, hindi ka pa rin pwede lumabas noon. You are going to sign an undertaking that you will complete the 10-day quarantine. 7th day na yon, di ba? So magti 3
Mm.
days sa bahay. So dapat nag-party siya after 10 days. So si poblacion girl, kung gusto niya palang mag-party on the 23rd, she should have arrived earlier. Ganun kasimple lang yon. She should have scheduled a flight 10 days before the party para naka-attend siya nung party, na-complete niya na yung quarantine. That would have been the safe thing to do.
Like Doc, yan, there is a clear violation. Is there a case? Pwede bang
Finale na
mag-file
yata
ng
ng kaso.
case?
Yeah, they filed the case against her and the hotel has been closed.
Has
by
been closed.
Makati.
Pero halimbawa, itong admin namin na may ganitong proof of it's a violation, I think, because hindi nagre-require ng vaccination. Tapos pwedeng pumasok ang mga tao dito na hindi vaccinated.
Ang magko-complain dyan kayo na residents. Remember, you are all homeowners there, di ba?
Yeah.
So you have the condominium association, the homeowners association, to change that policy. It's just a one letter from someone. And if it's a doctor living in that area, in your building, baka mas valid yun kasi naintindihan niya yung policies na yun. So I don't know why they're very lax and very
I
lenient.
know.
Maybe they own many units.
Yeah.
Maybe the officers
Well,
own many
I will send them a copy of this episode, especially this segment, or on their email, and I will make them see that what they're doing is a violation of I would say human rights,
It
right?
doesn't follow the minimum public health standards because the minimum public health
Precisely.
standard is we should check for the vaccination status to enter a facility, to enter an office or building. Diba? At alert level 3, which where we are now, you are in NCR, right? You are in
Yes.
Metro Manila. So you are under alert level 3. And under alert level 3, the unvaccinated are required to stay home. So if they're going to be moving, there must be valid reason if they're moving. So either they're proof of a negative PCR. So pwede naman tumira at mag-Airbnb yung unvaccinated dyan. Pero may proof sila of negative PCR. Diba? So pwede pa rin.
But the building, I think the administration should still require it for safety precautions.
Yes, of course. Of course, I think your officers and association should study that policy and renew that based on the alert level policies and the nature of Omicron. Remember, pinag-uusapan natin almost the nature of Omicron is it's very infectious.
It's
very airborne. Infectious. It's airborne, so someone can walk in the elevator, cough there, walk out, and then you unknowingly, a resident there, can walk in and get infected when you enter that elevator. So, very important yung measures na. So, dapat yung elevator nyo laging nililinis at sinasanitize.
Well, they claim that they disinfect it every hour. It's on it's on their
And
note doon sa elevator.
it's very important that elevators have good ventilation. Yan ang nakakalimutan ng ibang association. So the elevator is an
Mhm.
enclosed space, but actually you should attach a fan or a ventilator that circulates the air.
There is, I think, on top of the on
Kung
top
meron,
of
it's
our
good.
elevator.
But dapat
Yeah,
i-heighten nyo na talagang lagi naka-on para nasi-circulate
yeah.
yung air, nag-exchange with outside air.
Doc, with regards naman po, binanggit nyo kanina na yesterday and today meron tayong 5,000. How are the hospitals, especially sa PGH, Doc, how are you coping with the number of
Okay.
patients coming in?
It's been very difficult, no? You've heard our spokesperson, Dr. Jonas Del Rosario, say we have had 510 healthcare workers infected of the 2,000 healthcare workers.
Yes.
That's almost 25%. So talagang nahirapan kami. And then pinagdo-double shift yung ibang nurse. So nagko-complain. In fact, naggawa kami ng policy na shorter quarantine period for healthcare workers na na-expose, na low risk.
Mhm.
Na ngayon kinokontra nila. So now they're
Mhm.
have a press conference na ayaw nilang i-shorten, gusto nila 10 days pa rin yung bakasyon nila even if pwede naman. Kasi sa Amerika ganun ang ginawa. The US CDC shortened the stay of the quarantine of the exposed healthcare worker, and kung asymptomatic ka at negative ang antigen test mo or PCR test mo, pwede kang magtrabaho. Kasi the old policy was, once you're exposed, talagang 10 days kang hindi magtatrabaho. So ngayon,
Okay.
namin, kasi kulang na. Tapos mag-N95 ka para if you develop symptoms, mas konti ang mahahawa mo. Talagang true N95, hindi KN95 lang. So yan, mahirap din, no? Kasi nga, kulang na kulang kami ng tao. So that's why this Omicron is bad. Tumataas ang need for hospitalization, bumababa ang personnel. Nagkukulang. So even before the hospitals get full, hirap na kami. So ano ba yung sa report today? 65% utilization rate. Pero 65% beds mo occupied. Pero ang nurses mo, 40% na lang. 30%. So kulang na. So we're closing down units and services para to keep care of the current. So crisis na rin. So we are already having a crisis at the hospitals. And if you heard, di ba, yung mga airline nga nagka-cancel ng flight. Kasi nai-infect yung mga flight attendant, yung piloto. So you have people that were in their flights are being canceled abroad and here. Even here, nag-uumpisa na mag-cancel ng flights. And you don't know why it was canceled. I'm sure it was lack of flight attendants or people na na-infect.
Yeah.
Very
Meron na pong tanong si Fred. Sorry, Doc.
No,
meron pong tanong si Fred. Bakit daw hindi
Go ahead.
Sorry, Doc. Bakit daw hindi ginagawang mandatory ng gobyerno ang vaccination?
Because it's still experimental and it's also a human right. Now, ang hope namin is that 90% of the people, konti lang sila, ayaw namin dumami ng anti-vaxxer. Kasi if 90% of the people get vaccinated, walang effect na yan. Kasi si Omicron, mahihirapan hanapin silang walang bakuna. Pero pag maraming unvaccinated, madaling magkakalat. So, in the Philippines now, we have 51 million people who have full vaccination at 2 doses. And then we have 2.8 million na may 3 ng dose. So, ilan ba tayo sa Pilipinas? 110 million. Subtract 51. Subtract 51. May 60 million naglalakad dyan na wala pang bakuna. So when Omicron comes in, ang hahanapin niya at tatamaan niya ay yung 60 million Pilipinos. Kaya sinasabi namin talaga sa mga tao, magpabakuna kayo, magpa-full dose kayo, magpa-booster kayo. Kasi nakita, if you have 1 dose, para ka ring unvaccinated. You're partially vaccinated. Pag 2 doses ka, it's better to have 3 doses. Mas maganda ang chances mo na hindi ma-hospital. Boosted ka. So, to me, yan dapat ang reminder natin dito sa video vlog natin. Luzon, Visayas, Mindanao, magpa-booster na po kayo. Magpabakuna na po kayo. Lalo na kung kayo ay high risk at senior citizen, may comorbidity, magpabakuna na kayo. Dadating po ang Omicron sa lugar nyo. Nandito lang karamihan ngayon sa NCR pero dadating din po yan, Luzon, Visayas, Mindanao. and better be vaccinated already para may panlaban tayo.
Meron po tanong dito si Lizelle. Can we have that again, Lilibeth? Yung last, what medicine should we take once we are infected with Omicron?
Depends. That depends. No? Pagka mild and asymptomatic, you just need to take paracetamol. Yung tinitake mo, vitamin C, zinc, vitamin D3, vitamin B. So all of these are good. And then what you advise kanina, take take honey, take lemon fruits that have rich in vitamin C. Kainin mo, citrus fruits, and be healthy. Eat a healthy diet. That's the best way to boost your immune system to fight the mild infection. If you start to have moderate symptoms, so maganda rin may pulse oximeter ka sa bahay para nakikita mo if you may need to go to the hospital for x-ray and admission at baka kailangan mo na ng oxygen. So very important din na yun ang babantayan yung complications of very severe case of Omicron.
Ako, Doc, meron lang po akong ginagawa to test my oxygen. Nag-breathing exercise ako. I will breathe deep from my nose, papasok, tapos nagka-count ako ng 1 to 20, slowly releasing the air. Kasi I think 15 seconds na nag-slowly release ka, ibig sabihin, your oxygen is still okay because you can still manage to slowly release your air. Is that accurate, Doc, what I do?
Yeah, that also works, but I have a better technique and I'll teach you now.
Doc.
So I'll teach you now. So the first thing is you follow me. You inhale normally. Okay, don't exhale. Inhale another gulp. And don't exhale. Inhale a third gulp. Then slowly release. Slowly release what you do. Now you do that about 5 to 10 times every hour. Your pulse oximetry will go up. If you have a real pulse oximeter, makikita mo magna-99 yung pulse oximetry mo. So what we've just done is to use the functional reserve capacity of Napansin mo, you were able to take 3 gulps without exhaling.
Yeah, I did.
So that's the capacity of your lungs that you're not using. 2/3, you're using only a third of the capacity of your lungs. So if you inhale, so you expand your whole lungs, you got more oxygen, you get more oxygenation.
Okay,
diba?
Okay, Doc. I got it. Yeah. At saka parang yung likod mo lumalaki.
Exactly.
You can actually feel expanding.
Alveoli. Ako nakikita ko the alveoli of the lung parenchyma are expanding. I've seen this kasi in the operations that we do. Nag-expand pag binaventilate no anesthesiologist, nakikita ko. Kasi yung mga collapsed saccules doon sa lungs mo, nag-open up. In fact, yung iba, pagka may plema dyan, naglalabasan yung plema when I do these deep breathing exercises.
Okay. So Doc, ngayon po na nandito tayo ngayon, pataas ang kaso. Ano po ang gagawin ng gobyerno through IATF that we all need to follow? Meron po ba kayong recommendation ngayon ang gobyerno para sa aming mga citizens?
Well, number 1 is magpabakuna. Number 2, makinig sa mga authorities and follow the rules. Huwag tayong pasaway. Pag sinabing huwag pumunta sa mall, huwag pumunta sa mall. Pagka sinabing alert level 3, bawal ang contact sports, bawal ang contact sports. Pag sinabing localized lockdown ng inyong local officials doon sa area nyo dahil napakaraming positive, sumunod tayo, huwag tayong kumontra at huwag tayong pasaway. That's the only way we can break the transmission if we all work with solidarity with government. By being counter to the government doesn't work. It just makes our life harder. See what's happening in America. See what's happening in the UK. Ayaw nila mag-mask. O ayan, 1 million a day ang kaso nila. Ayaw nila magpabakuna. Di ba? I think their vaccination rate is lower than us. We've got a higher vaccination rate than... And they're a vaccine-producing country. We have to import the vaccines, di ba?
How ironic is that, Doc?
How ironic is that? In fact, they're donating their vaccines to us and we're giving it to Filipinos. When in fact, nakita natin, last year, wala tayong bakuna. Face shield lang ang ginamit natin. Face shield, face mask. Di ba napababa natin? Kahit pa paano, nag-konting Christmas celebration tayo.
Yes.
This year, nagamit natin yung bakuna. So, pero kulang pa rin kasi ang dami pang hindi vaccinated. Only 51 million Filipinos are vaccinated. There are 60 more million to go. Actually, hindi pa kasi wala pa yun sa bata. Kasi for those with children na nakikinig, may good news ako sa inyo. Yung in-order natin, 15 million doses of pediatric Pfizer will be arriving in the middle of January. So hopefully by February,
Oh, it's coming.
inject na
It's
tayo ng
coming.
5 years old to 11 years old. Kasi yan, ginagawa na nila sa US and UK. Nag-i-inject na sila. So, I do hope mabakunahan na sila kasi sila yung at risk dito sa Omicron. Yung mga teenagers na hindi pa nababaccinate, I've been talking to some teenagers in schools. Sabi nila, Dr. Herbosa, gusto namin magpa-vaccinate, ayaw ng parents namin. So yung parents ang hindi well-informed. Mas nagbabasa ng internet yung mga bata at gusto nila magpa-vaccinate. But because they're below the age of consent, they need parental consent. So mukhang kailangan makumbinsin natin yung ibang mga magulang niya na pabakunahan nyo na yung mga teenager na anak nyo para makalabas sila. Kasi vaccinated, unvaccinated, di ba? Hindi makakalabas. So pabakunahan nyo na. It's safe. Merong side effect. Wala tayong magagawa. Every medicine you take has a side effect. Ganon din tong vaccine. May side effect din. So, pero hindi natin maaalis yon. But the benefits far outweigh the side effects.
The side effects. Ito po, Doc, talong na naman ni Lizelle. Kailan po dapat uminom ng ivermectin?
Actually, yung ivermectin proof hindi na nag-catch on. So, ivermectin was parang sa hindi nakakaalam, yung ivermectin is a traditional medicine for river blindness. It's for a worm. It's against a parasite. It's not against a virus. Now, some doctors abroad claim that it helps protect individuals who take ivermectin regularly. Actually, I'm one of those who's not a believer of this. I've looked at the data. I've looked at the science. It's not robust. The studies don't show. So eventually, ang dami naming cases na naka-ivermectin na ICU at na-intubate. And it would have been sad. Sana nagpapakuna na lang sila. So to me, sorry, but wala pang data but I'm open to it. If they're able to show very good data that it does work, pwede ako uminom yan. Pero as of now, when I studied all the publications, parang hindi ako naniniwala. And I will not recommend it. Kung hindi ako naniniwala at hindi ko iinumin, ba't ko siya i-recommend sa tao?
Ito tanong mo naman ni Lizelle ulit, marami ng vaccines na dumating pero may supply ba ng syringes? Do we have enough supply?
Yes. Nagkakaubusan din yan kung minsan, sometimes the vaccines aren't being given kasi hindi nagkakaroon ng delay yung pag-arrive. Pero when we ordered the vaccines, may kasama silang syringes. Especially the Pfizer. So, especially the Pfizer kasi important. At saka may substitutes naman kaming nagamit, yung mga 1 ml tuberculin syringe. So there are options. Pero bibilin mo pa rin, gagamitin mo pa rin.
Yeah.
So totoo yan, pwedeng maraming bakuna pero hindi
marami ang syringes.
Ancillaries, tawag namin yung ancillaries. Meron din kaming bakuna pero kung minsan hindi mabigay dun sa LGU kasi Pfizer siya. Requires ultra low temperature freezer. So wala silang storage. So may mga ganong problems. So there's what we call supply chain. So it's not a problem of supply. It's a problem of the cold chain.
Of storage.
Yes. So paano kita bibigyan ng bakuna na ilang libo pagkatapos masisira lang dahil wala kang freezer? So
ano po ginagawa ng gobyerno tungkol dyan?
Yung tama lang.
Yeah.
Hindi, ang ibibigay ko sa kanila, yung tamang amount. Dapat pag nakuha mo, ibakuna mo kaagad.
Okay. Huwag nang patagalin.
Oo, pwede pang i-refrigerate for 5 days. Pero hindi mo pwedeng itago yan, di ba? Masisira yan. So yan mga issues namin. Tapos meron kaming mga single dose na Janssen or Johnson & Johnson. Binibigay namin siya dun sa mga remote area. Kasi di ba, sa mga lugar na yun, tumatawid pa ng island yung mga tao, mas maganda single dose ang ibigay sa kanila para hindi na sila mahirapang pabalik-balik. Tapos yung matanda na bedridden, house to house, binibigyan namin ng Janssen. So may mga gamit yan. So it's a very complex operation. Many people think it's very simple to jab But this is a big
No.
supply chain logistics and nightmare
Yeah, I
to
could
distribute.
imagine, Doc. I could imagine.
But we've done very
Doc,
well.
so,
Vaccinated 51 million. So
yeah,
nothing argues with
yeah.
that. Nung una,
Congratulations
sabi
to the
nila, hindi daw
government.
magagawa. 25 years daw bago makabakuna. Excuse me, no? Ang gagaling ng mga tumulong. So yung mga kumokontra, tahimik sila ngayon kasi naka 51 million Pilipinos na tayo.
I do
Fully
not
vaccinated.
understand. Instead of kumontra kayo,
Helping.
tumulong na lang kayo.
Exactly.
Diba?
Oo, negang-nega. Sabihin, at the rate that the government is vaccinating, it will take 25 years. Oh, madali
Yeah.
natin 25 years. May 51 million Filipinos nang fully vaccinated. And they're thanking me. Kasi nga, ngayon, pag natamaan sila ng Omicron, safe sila. Di ba?
Safe
They won't be
sila.
hospitalized.
Yes, yes. Like me, na-save
Yes.
ako ng vaccine, Doc, like me.
Correct.
I'm
And that
very,
should be what we tell.
yeah, I have very, very mild symptoms except the first 24 hours. Yun talaga yung, nung nag-set in siya, I felt sumakit ang kalamnan ko, sumama ang pakiramdam ko, but it was just 24 hours. After that, I went back, I bounced back to feeling better, but of course, I lost my sense of taste and sense of smell. But it's part of the symptom. I'd rather have that than severe cough, severe
And go
colds.
to hospital
And-
where there is no bed.
Yes. Yes, yes, yes.
Naiikot-ikot
Tapos
ka,
sa hospital ako, walang kama.
Oo, walang.
Yes. Thank you to
Walang
the
nurse.
vaccine.
Oo.
Yes. Kaya magpa-vaccine
How
po
did you
tayo.
feel when you got vaccinated? Did you also have fever and symptoms? Or
Nung yung first job ko po, nahilo ako like I've never been nahihilo like that state. Pero nung itinulog ko, pagising ko, gutom na gutom ako. So, I think my side effect, 4 days akong matakaw. Yun po. Yung
that means your
first.
immune
Pero yung
system was
second,
triggered. Para ka nang nagkasakit.
Yeah, tapos yung second, wala po ako masyado naramdaman nung pangalawa. Itong booster, I don't know what's going to happen. Dito sa booster, kukunin ko pa lang siya on the end of the month.
What vaccine did you get? What vaccine?
Sinovac.
Oh, so I also got
Sinovac.
Sinovac. My first dose was actually like you. We're the same, no? Ganun din. Nag-fever ako, nag-paracetamol ako. I felt better when I woke up in the morning. But my second dose was mild. Walang naramdaman. Exactly like you. I got my booster 8 months later, which is the Pfizer. I wanted also Sinovac, pero Pfizer ang available. So sabi ko, sige, bigay niyo sa akin yan. So I took Pfizer. Ako, napakasama ng epekto sa akin. I had the COVID arm. I think I took about 3 paracetamols kasi talagang I had fever. Talagang yung trangkaso feeling.
Yeah.
Trangkaso feeling. Down ako overnight the day after. So, sabi ko, I thank God, nag-kick in yung pero kinakabahan din ako. Kaya I wanted Sinovac also kasi alam ko nang okay yung response ng katawan ko doon.
Yeah,
bago siya, sabi ko, teka muna, baka mag-myocarditis ako or thrombosis or some of the other side effects. So, takot din ako. So yun yung what you weigh in kasi when you get your third shot, you will be asked kung meron kang preference kasi nga all the vaccines are available. So
Doc, do you advise me to get Sinovac still?
So you can get Sinovac as well or you can get any of the others. You can get Pfizer, Moderna, or AstraZeneca as your may 3 choices.
Should it matter? Should it matter, Doc?
Ang findings kasi, pag pinag-combine mo yung heterologous, we call it heterologous combination, the boost is higher than the same. But yun nga, yung iba naman doon, you don't know if the new one, the new brand, baka iba ang tama sa katawan mo. Baka ikaw yung statistic ng side effect. Di ba? mRNA. Collapse right there on the video, di ba? So, hindi mo rin alam. Like ikaw, sabi mo, hindi matay ka nung una. I don't know what that mRNA would affect to you. So ganun din yun. There's always that anxiety of it's something new that will be injected in.
So, datong ulit si Rizal, should we always get booster after every 3 months?
No, wala pang alam na gano'n, no? So the only reason we're giving a booster shot is there is evidence to show that 3 shots protect you better against Omicron. That's why 6 months actually yan eh. Naalala nyo, 6 months yung
6 months.
And then nung pumutok yung Omicron, binaba ng DOH to 3
3
months.
months.
Kasi lumabas yung data na of all those that had booster shots, mas mild yung symptoms nila. So minamadali natin yung boosters, kaya 3 months na lang yung interval to protect more people against Omicron. Kasi nakakahawa talaga siya. So binuboost natin talaga. So I don't know.
So after the booster, kailan po kami pwede ulit magpa-vaccine?
Hindi pa natin alam. Unknown.
Hindi pa alam.
So yan,
Okay.
uncertain. Kasi remember, this is like flying a plane while making it. Di ba?
Yeah,
This is a new virus. This is a new disease. Even the mutations we cannot predict. We cannot say this is the end game. We don't know if but they're studying that. Of course, they're studying the first people that got vaccinated and following it through over time. What we know is your neutralizing antibodies wane over time, bumababa. But we also know that your cell-mediated immunity or T-cell response is lifelong. So ibig sabihin nun, kahit bumaba ang iyong natural antibodies against COVID, you still have another immune part of your system that tells and orders your body's white cells, phagocytes, and all those other defense mechanisms to attack the new viruses. Parang may memory na sila. Nagka-memory. Uy, COVID-19 yan. Oh, everybody, attack. Wala nang antibody si Peter. Produce tayo ng white cells. Doon, attack naman tayo doon sa... So, mild pa rin ang magiging symptoms. So, yun yung sinasabing lifelong immunity. Because your body already recognizes the illness. So, tsaka chickenpox, hindi ka na magkaka-chickenpox. Kasi you're already immune to chickenpox. Kahit wala kang booster dose. Ganon din ang measles. Nagka-measles ka, lifelong na yung... Alam na nung body mo na pag tumasok si measles virus, kalabanin natin yan.
Kakalabanin na. Doc, how about, do you recommend flu shot and pneumonia shots?
Of course, because the symptoms of pneumonia through the pneumococcal is a bacteria actually. Bacteria pneumonia na may vaccine. Yung flu influenza yan. And you need to get the flu shot yearly kasi nag-iiba yung nilalagay nila. So napakaraming serotypes. There are about over 80 serotypes of influenza virus. So pinipili nila by mathematical prediction what will be the most likely outbreak for the following year. And then they put that into the virus. So yung bakuna nung last year, hindi useful for this year. So every year they change the laman because they cannot put so much variants in it. So ganun every year pa rin nagbibigay tayo ng shot for.
Pero ang pneumonia shot, Doc, there is a lifetime di ba?
Yes,
mas mahal.
yes, tama ka.
Tapos merong 5 years, merong 3 years.
Correct. Yung earlier version, may boost ka every 3 years, every 5 years. Pero yung later, lifelong. Pag na-inject
lifetime na,
lifetime na yung protection mo. So mamimili, mas mahal yung isa.
Mas mahal yung lifetime.
Kesa dun sa every 5 years.
Every 5 years. Pero Doc, di ba, let's say, kasi pneumonia ang isa sa pumapatay sa nagkaka-COVID hindi ba, Doc? So, kung halimbawa, hindi ka pa vaccinated ng whatever vaccines we have for COVID, but you have pneumonia shot, could that aid you to cope up?
No. The pneumonia shot is really for pneumococcal vaccine, pneumococcus microbe. So it protects you against that. So pneumonia can be caused by many things. It can be caused by a virus. It can be caused by bacteria. It can be caused by fungi. So many kahit chemical, pwedeng may chemical pneumonia. Pwedeng mag-cause ng pneumonia. So pneumonia is the inflammation of the lungs na hindi ka makahinga.
Okay.
So depending on the etiologic agent, So yung dalawa, it doesn't na pag may pneumonia shot ka, hindi ka na magkaka-COVID. Mali yun. Hindi ka magkaka-pneumonia due to pneumococcus. Pero magkakaroon ka pa ng COVID pneumonia. Pwede pa rin.
Okay. At least that's clear. Ito po, may isa na naman tanong si Lisel. May pagka-intrigera itong tanong ni Lisel. Natatakot daw siguro mag-supply ang mga suppliers ng syringes dahil sa nangyari sa Parmali.
Hindi naman. Kasi mas mura na yung mga binibili. Hindi ko naman alam talaga yung nangyari. Alam mo, yung family parang masyadong overblown. They're just
I
businessmen that
know.
got a business. In the end, when you look at it, they're very savvy businessmen that earned a lot of profit from an opportunity that they saw. And they bought
Yeah.
nice cars. I think that was their mistake. They bought very, very nice, expensive cars. Kasi if
At
they
ayaw ni
huh?
Senator Gordo ng mamahali ng kotse mo.
They should have invested it in their business and made it more robust, diba? You made a killing.
Oo.
It's very hard kasi to deal with government. An investment of 650,000 doesn't allow you to go bidding in the any government bidding. They look for your NFCC, tinatawag nila, net
Yeah.
financial something certificate. So
But that's
when you
what Bayanihan eliminated from it all. Yung the
because we
Bayanihan
were
no
in a crisis, so
eliminated, it
technically,
eliminated that, the bidding.
yeah. So
You just buy what's available.
oh,
And the ombudsman said that there is no corruption, and the DBM said there is no overpricing. So where is this all coming from?
pero
If you
pero
think
kinulong
about
sila kasi ayaw nilang
kinulong
ilabas
nga
yung
eh.
delivery schedule nila. Hinihingi yung delivery schedules nila. So nakakatakot yun. At saka may tinamper sila doon sa manufacturer. When they describe that, sabi ko, uy, may kalokohan to. Kasi when you start to tamper, kasi yung manufacturing date, hindi siya expiry date, it's a manufacturing date.
Manufacturing date.
When you tamper that, ibig sabihin nun, baka recycled siya. Diniliver mo na, kunyari nag-deliver ka ng bagong lot kasi iba naman ang manufacturing date and someone will sign receipt. So it's the modus operandi for ghost deliveries. So Senator Gordon was onto something there. Tapos ayaw nilang magbigay. And if you're a company holding 8 billion contract, your papers and delivery schedules must be readily available. But ayaw nila ilabas. O because ayaw nila ilabas, o yun. Diba? Sampina duces tecum eh. Diba? Anything that the Blue Ribbon. So, pinakulong sila for parang resisting to come out with the schedule. So, let's see what happens.
Let's see what happens. Let's see how good the lawyers are.
Pero parang nakalimutan na. Parang tumahimik na.
Oo nga eh. Thank you, Lizelle, for bringing that up.
Baka meron na pang-kampanya. Oo nga, nasa na sila? Nakakulong pa ba?
Nakakulong pa po si Mr. John Ong.
Oh, wow.
Kudos talaga sa government. Maswerte tayo kesa sa ibang countries. Vaccines in other countries are being sold to its citizens. Tama po ba, Do?
Correct. We loaned money. We used our savings. So, ang ginawa ng government, kinuha yung mga hindi na gastos na budget CAA. At I think we loaned about, so umabot yun ng mga 50 million parang ganun Pagkatapos, 70 million pala, 74. Pagkatapos, kumuha pa tayo ng loans. We took loans to buy vaccines and make it free for everybody.
Yeah.
The problem with selling it to actually we did, with the tripartite agreement. We actually technically did. You've heard about the tripartite agreement.
Sorry, please.
The tripartite agreement is the agreement with private sector to buy their own vaccine. And then actually they were asked not to profit from it. So that means they will pass it on to the public at cost. So yun ang sinabi.
Okay.
Pero actually nag-profit din sila kasi nung bumili sila together with government, mas mababa yung presyo nila kaysa sa binayad ni Pilipinas.
Okay. So,
pero nung
paano yun, Doc? Meron ba silang pananagutan yung mga kumpanya na gumawa niya?
Sabi nung teka, balik niyo sa amin yung sobra. $19 nilang pala binili $25 ang siningil niyo sa amin per dose. So, $50 for 2 doses. Sabi nila, hindi, may cost sa administration. So, hindi na rin ni-refund. So, okay naman. I think the private sector is trying to help government. But technically nga, sabi ko, I am against it being, kasi pag ganito yan pag yung vaccines ay binenta mo na, you have to apply for CPR, Certificate of Product Registration. Walang nag-a-apply. Kasi bakit? Gusto nila yung EUA. Kasi ang indemnity wala sa kanila. Pag may nangyari sa it's the government that will pay your indemnity for damage.
Okay.
But once you start to sell it to individuals, they're now open to lawsuit. You get?
Okay.
Kaya mas gusto nila itong system na to, naintindihan mo? So sila mismo ang hindi nag-a-apply for CPR.
So, meron bang violation, Doc, along that line?
Well, in my expertise, we call that regulatory capture. They found a way to get around the regulation of government and still earn profit billions.
These private companies.
What happened? The company passed on the risk to government. Parang hindi niya sinalo. Ito, bakuna na discover namin para sa Covid-19. May side effect. Ito, dineclare, nilista nila yung mga side effect, nakalista doon. Pero pag nagka-side effect yung binigyan nyo nito, ay kayong magbabayad sa kanila, hindi kami. Ganun yung kontrata natin. Galing, ano?
Who made that contract, Doc?
They did.
And who approved that?
They did. The private, yung mga companies na yan, ang gagaling nila. Kasi they learned from Sanofi. They learned from Deng Baksha. Remember, we sued.
Oh my God. But that is a very anomalous contract na Deng Baksha.
Yes, actually, binigyan ng CPR, experimental pa siya. Pagkatapos, binalik nila yung pera, binalik nila yung bayad. So talagang may problema talaga yan. So, because the other companies saw that, ayaw nilang ma-lawsuit. Kasi sa Philippines talaga, sa Amerika kasi at saka sa UK, meron silang vaccine courts. Because they are vaccine-producing countries. So they protect their vaccine manufacturers from collapse. Kasi kundi, magko-collapse yan. Kasi pag na-demanda yan ng mga side effects. So they have vaccine courts that pay the indemnity. So gusto nila ganun tayo. Because we don't have vaccine corporations naman that make it. Abay, foreign yan eh. Pagka napahamak ang Pilipinas, demanda ko yan. Di ba? So ganun. So ganun ang ginawa natin sa Sanofi. Dinimanda natin ang Sanofi dahil they saw about 150 children that died after being injected ng vaccine.
Yeah. And so still, that case is not resolved yet.
Not yet resolved.
I think that created a scare sa vaccine. Yung vaccine na yan.
Oo. Tapos, hindi lang yun. So ngayon, ayaw nila mag-deliver. That's why we started with Sinovac. Because it was the Chinese that delivered the vaccines. Had the Chinese not delivered the Sinovac, ay bay, niraragasa na tayo nitong Omicron kasi walang vaccinated. Kasi nag-deliver lang naman later nung you pass a law first that you will pay indemnity. So in 7 days, pinas yung law na yun. Tapos, when we passed it, hindi pa rin nag-deliver. So, deliver sila later. So kasi nasa huli na raw tayo ng pila, di ba? Yung queue.
Yeah.
So, another usapan yan. That's a nice discussion.
Yeah. We will have another discussion with Dr. Herbosa with regards to the vaccine, the regulations, with the private company, and how it actually works with the government and the private sectors. Pwede ba, Doc? One of these days again?
Sure. Walang problema. Pero medyo mas complicated yung baka hindi maintindihan ng ating mga televiewers. So,
we will try to simplify it now.
I hope we can simplify it, but it's a very complex web of events, and it's a global thing.
Yeah, it's a global thing. So, Doc, well, thank you very much for your time, for making it clear to us how to deal with the Omicron and how it is really naniliwanag natin ang myth, I would call it myth, na medyo hindi sinasadyang bitawan ni Father Austriaco sa kanyang salita na na-retract naman pala ni Father ang sinabi niya at ng UST. I think UST retracted it. If he retracted it, probably UST retracted it. We have to tell you thank you, Doc, and please give us a very, very sound advice that we will all live with.
Well, first of all, I wish you well. I hope that you will fully recover. Looks like you're on the way because you're giving me an interview. So I suppose you're able to work. So that's very good. I do hope tuloy-tuloy na yan and you get your booster soon enough. And all our televiewers na nakikinig, please get your booster shot. If you have relatives that still haven't been vaccinated, convince them this is the time to get vaccinated because there's ample supply of vaccines. And then if you need to go out, continue to protect yourselves. Huwag tayong mapagod. This is a marathon. This is not a sprint. This is not the end. You just pace yourself. Take care of yourselves. There's mental health and emotional resilience that you need to work out. I know isolation is not an easy thing, but keep in touch. Sabi niya, dapat nga mali daw yung word na social distancing because we remain social. We talk to
We
friends.
are social
Even
beings, yes.
if we are still in isolation physically, but we still need to connect. So very important,
Yes.
connect, talk to people, talk to experts, exchange ideas. Let's keep our sanity despite this third year of this pandemic. Pangatlong taon na. We're entering by
Mm,
March. It will be our third year of the pandemic.
yes.
So 2020, 2021, now it's 2022. The 2 years went by so fast, but we've learned so much about ourselves. Madaming natuto. Madaming magaling magluto na sa bahay. Madaming
Opo.
nalaman. So, and then we've discovered our true friends na tumutulong sa atin in time of need. So, marami ring
Mm,
blessings na binigay itong pandemic. So, keep
yes,
everyone
definitely.
and thank you for interviewing me in this Luzon, Visayas, Mindanao, Pilipinas muna.
Pilipinas muna. Thank you very much. Magandang gabi, Doc. God bless you.
God bless you. Magandang gabi, Peter.
There you have it, mga ka-3PM. I hope maraming nabuksan ng utak sa mga nangyayari sa atin ngayon. When you get infected by the virus, it should serve as a lesson to all of us. Ako, I am just glad it happened when it happened, na vaccinated ako, na hindi ako nagkaroon ng severe symptoms because this virus kills. Omicron still kills. It is not as mild as what we think it is. Ngayon narinig natin kay Dr. Herbosa kanina, sinabi niya may mga namamatay pa rin sa ospital. We have to be very, very careful right now. I might have been uncareful in one of my dealings sa paglabas because sometimes because we have been living with it for a long time, siguro nare-relax na rin tayo, especially the past months na medyo bumaba ang cases natin. Siguro nagiging masyado tayong kampante or relaxed sa ating mga gawain sa buhay. Maybe I have forgotten to bring my alcohol sprayer. Maybe I wasn't too careful touching things that I shouldn't be touching. Or maybe I have placed my hands on my mouth or nose or eyes that I wasn't very much aware of anymore. Siguro I committed a mistake along the way because I was kind of relaxed already. So we really still have to protect ourselves by continually being more careful, being more wary about our surroundings. Wag po tayong ma-relax just because, especially now, 33,000 cases today. And Dr. Herbosa said, we might reach 40,000 just before the month ends. And this is not a case of every month. This is a case of everyday cases. At ito pa lang po yung declared. Kagaya ko po, nag-home test ako, hindi ako recorded, but we have to be more careful on how we deal with our surroundings in the coming days dahil Omicron is not a joke. Even if it is a mild symptoms, napakabilis niya pong kumalat, napakabilis niya pong humawa. At doon po sa mga negatrons, sa mga mahilig mag-negate sa ginagawa na ng gobyerno, this is 2022. Come on, people. Let's start helping one another. Let's start doing what is good for each other. Let's just stop doing what we're used to since 2016 of negating lahat ng ginagawa ng gobyerno para sa atin. The government is doing everything it can, as what Dr. Herbosa said. Already 51 million Filipinos have been fully vaccinated, but we still have half of the citizens to get vaccinated, and we're still halfway through it. Let's help each other. Let's help each other. It's the time, 2022 na. Let's be more consensuous with how we deal with one another, especially with the pandemic still around us. It's still around us. And I think it's still going to be with us for another 2 years probably. But we need to learn to live with the virus. We need to learn to live with the pandemic. We need to learn to coexist with it already. Iisa lang ang katawan at bayan natin na dapat nating alagaan. Kaya't bago ang sarili, bago ang ano paman, kalusugan muna, Pilipinas muna. Magandang gabi po.